Bloating, pain, and gas are common gastrointestinal symptoms that almost every single one of us experienced at some point in our lives. Bloating is defined as the uncomfortable sensation of fullness or swelling in the abdomen, often caused by the buildup of gas or fluid in the digestive tract. Gas, however, occurs as a natural byproduct of digestion, particularly when the body breaks down certain foods in the intestines. It can lead to belching or flatulence, which helps expel excess air or gas from the body. Abdominal pain may accompany bloating and gas, and can range from mild discomfort to severe cramping, depending on the cause. While these symptoms are often harmless and linked to temporary issues like diet or mild digestive disturbances, they can sometimes indicate underlying health conditions that require special attention. This is why in this video, we will reveal to you when to see a doctor for bloating, pain, and gas. Now, without any further ado, let's get to it. Number 1. Persistent symptoms. If bloating, pain, or gas aren't temporary and last for more than a few days, or become chronic, it could suggest a more serious underlying digestive issue. In case your symptoms last for more than 2 weeks, especially if you also notice changes in bowel habits, you should get evaluated by a doctor as soon as possible. A study published in Clinical Gastroenterology and Hepatology in 2020 examined the prevalence and persistence of bloating and gas in individuals with functional gastrointestinal disorders like irritable bowel syndrome. This study used questionnaires to assess the persistence of bloating and gas over 12 months in 2,000 patients. It was found that 20% of individuals experienced persistent bloating and 30% reported persistent gas. Number 2. Severe pain. Having severe pain is an alarming symptom. Intense or sharp abdominal pain that comes on suddenly, especially in specific areas such as the lower right abdomen, can be a sign of conditions like appendicitis, gallstones, or a bowel obstruction. A study in the Lancet Gastroenterology and Hepatology that was published in 2017 investigated the relationship between acute abdominal pain and emergency surgical conditions like appendicitis and gallstones. The research involved reviewing medical records of patients presenting with acute abdominal pain over 5 years. The causes were identified through imaging and surgery. Approximately 10% of patients with severe pain were diagnosed with appendicitis, and 20 to 25% had gallstones or biliary colic. These conditions were more common in women and older adults. Number 3. Unintended weight loss. If you are losing significant weight without trying or doing any changes to your diet or activity, then you should be concerned. Especially if this weight loss is accompanied by bloating and gas. Then this could be a sign of gastrointestinal issues like celiac disease, Crohn's disease, or even cancer. In 2019, a study was published which explored unintentional weight loss and its association with serious gastrointestinal conditions, including celiac disease and cancer. Researchers followed over 1,500 patients reporting weight loss with associated symptoms of bloating, pain, and gas for 12 months, performing diagnostic tests such as endoscopy and imaging. As per the results, 15% of participants had celiac disease, and 8% were diagnosed with gastrointestinal cancer. Those with weight loss had a significantly higher risk of serious conditions than those without. Number 4. Blood and stool. The presence of blood in the stool, whether bright red or dark and tarry, along with bloating or pain, may indicate gastrointestinal bleeding from ulcers, inflammatory bowel disease, or colorectal cancer. An article in Annals of Internal Medicine published in 2018 observed the significance of blood in stool in combination with bloating and gas, focusing on conditions like inflammatory bowel disease and colorectal cancer. Here, over 3,000 patients with gastrointestinal symptoms were assessed for blood in the stool through colonoscopy and biopsies. After analyzing the results, 6 to 10% of patients with blood in their stool were diagnosed with colorectal cancer, and 12 to 15% were diagnosed with inflammatory bowel disease. These findings suggest that blood in the stool is a strong predictor of underlying pathology. Number 5. Changes in bowel habits. If you notice prolonged constipation, diarrhea, or alternating between the two, especially with bloating and gas, it could be a sign of irritable bowel syndrome, infections, or inflammatory conditions like inflammatory bowel disease. Published in the American Journal of Gastroenterology in 2016, a study that looked at changes in bowel habits, such as diarrhea and constipation, associated them with irritable bowel syndrome and inflammatory bowel disease. Researchers tracked the changes in the bowel habits, bloating, and pain of 2,500 individuals with chronic bowel symptoms for over 2 years. According to the results, 25 to 30% of individuals with changes in bowel habits were diagnosed with irritable bowel syndrome, while 10 to 15% were diagnosed with inflammatory bowel disease. This shows that the presence of bloating and gas is common across both conditions. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Nausea and vomiting. Frequent nausea or vomiting with bloating and gas may indicate a blockage or gastroparesis, where the stomach fails to empty properly and needs prompt medical evaluation. If we take a quick look at a 2020 study that was published in Digestive Diseases and Sciences, we will see that it explored the prevalence of nausea and vomiting in patients with gastroparesis and small bowel obstructions. To conduct the study, a group of 1,200 patients presenting with chronic nausea, vomiting, and bloating were assessed using gastric emptying studies and CT scans to diagnose gastroparesis or obstruction. 25 to 30% of patients with these symptoms were diagnosed with gastroparesis, while 10 to 12% had small bowel obstructions. These conditions were found to be more prevalent in patients with diabetes or a history of abdominal surgery. Number 7. Fever. If bloating, pain, and gas are accompanied by a fever, this could signal an infection such as diverticulitis, appendicitis, or peritonitis, all of which need urgent medical care. A study in the New England Journal of Medicine in 2015 examined the relationship between fever, bloating, and acute abdominal infections like diverticulitis and peritonitis. Researchers analyzed medical records of 500 patients presenting with fever and gastrointestinal symptoms, confirming their diagnosis through CT scans and blood tests. It was found that 25 to 30% of patients with fever and bloating were diagnosed with diverticulitis, while 5 to 8% had peritonitis. Early diagnosis and treatment were critical for preventing complications. Number 8. Difficulty swallowing or persistent fullness. If you feel full after eating only small amounts or have difficulty swallowing, this could indicate conditions like gastroparesis, esophageal strictures, or even stomach cancer. In Alimentary Pharmacology and Therapeutics in 2018, a study was published which focused on gastroparesis and its impact on early satiety, bloating, and nausea. The study followed 800 patients with early satiety and bloating, using gastric emptying tests and endoscopy to diagnose gastroparesis. As shown by the results, 20 to 25% of patients with these symptoms were diagnosed with gastroparesis, with higher prevalence among individuals with diabetes and post-surgical complications. Number 9. Family history of gastrointestinal conditions. If you have a family history of serious gastrointestinal conditions, such as colorectal cancer or inflammatory bowel disease, recurring symptoms like bloating, pain, and gas, you should discuss them with your doctor early on. A study published in Gastrointestinal Endoscopy in 2019 explored the genetic predisposition to colorectal cancer and inflammatory bowel disease in individuals with family histories of these conditions. Researchers tracked the health outcomes of 1,500 individuals with family histories of colorectal cancer or inflammatory bowel disease for 5 years, performing regular screenings and diagnostic tests. Results showed that individuals with a family history of colorectal cancer were found to have a 2 to 3 times higher risk of developing the condition. For inflammatory bowel disease, 15 to 20% of those with a family history were diagnosed, compared to 5% in the general population. So, these were the top reasons for when to see a doctor for bloating, pain, and gas. Now we want to hear from you. Have you ever suffered from any of these signs? What was the root cause according to your doctor? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.